Hi, my name is Dr. Clay Reedy, physical therapist at Sport Back and Pain Management Clinic in Bryan, Texas. Today we're going to talk about myofascial decompression. It's kind of a big term for a more popular version of what we call cupping. It became popular in this year's Olympics whenever you saw a lot of the swimmers and volleyball players have these big circle bruises on them. Really what cupping or myofascial decompression is they use a glass or a plastic cup, and it uses as a vacuum to kind of lift your skin off the bones and the tissues around there. We use myofascial decompression, not cupping, as physical therapists because it has more research and it's highly proven to be more effective. The reason why this technique is so important is because of fascia. And if you don't know what fascia is, it's a very thin kind of tissue that surrounds all of the bones, organs, and muscles in the body. In a healthy body, it becomes nice and slick and should slide through the bones and the muscles very easily. But when things get injured, it becomes sticky and starts adhering it. We kind of call it scar tissue or adhesions. What this procedure does is it helps lift those tissues up off the tissues around it or the bones and break those adhesions. So we're going to now kind of demonstrate a few techniques on how myofascial decompression can be used in physical therapy. So our system here is going to be kind of the body in which we're going to show the myofascial decompression techniques when it comes to improving shoulder range of motion or reducing pain when it comes to shoulder movement. So as we have her move her arm up and down and out to the side, what we're looking for is for tissues that don't move very well. Or if we're trying to press around here or palpating along her shoulder blade, trying to find tender points in which are sore or cause pain. So say if she's pretty tight right here, we can use different types of cups, whether it be small, like this one, medium, which one's on the suction device, or large right here, depending on how big the area that's being affected. So as we take a few pumps, and then we have a little bit of suction here in the cup. As you know, the area is becoming red. It means there's blood flow going into the area. That helps the whole healing process to that area as well. So here's the main difference here with cupping, is that cupping now, we're done. It just stays there and it kind of does its business. What we do as physical therapists is that we now add active range of motion. And we really kind of test and see where everything's tight. So she starts doing these patterns right here, or we can start doing more functional diagonal patterns. And she come out here, going across here. This really is challenging that mobility of that skin. So we just showed you one of the techniques when you're using motion, but we can also, as therapists, start moving the cup around itself. We can move it up and down, side to side. We can tilt it depending on which way we feel the most restriction. So as I'm going to reapply it again because it slipped off, I'm going to show you. So we go up and down. She doesn't want to move down very much. So I can also be pulling it down and have her move in different directions, maybe reach across her body and really stretch that tissue. So as I take the cup off though, you notice that it's definitely more red. That blood is still pulling right there. It's normal to have a bruise after the treatment. It doesn't always happen, but sometimes it does. She also has a little bit of bursted blood vessels called petechiae, so that blood really did kind of rush to that area, which is a good sign it's going to heal real well. So now I'm going to show the last technique that we can use while treating soft tissue adhesions using myofascial decompression. So I've showed you where we have it stationary, where she moves her arm, and then also where I'm tipping it and keeping the cup there, but kind of testing the tissue's integrity while moving the arm. Next, I can also slide the cup, and that really helps break it. It uses the border of that cup to really kind of break up some of those adhesions. I might need to start applying a little more suction as I go, because it tends to lose a little bit as we move it along. But then now I can have her bend forward and then come back. And then I can move it down a little bit more. And then she can bend forward again. And then she can also kind of turn a little bit to the left and then come back. And this is another type of technique we can do to really break up some of those adhesions, get that fascia and the tissues around there to move a little better, to also reduce pain and improve your mobility. I hope this gave you a little more insight about myofascial decompression therapy. We use it a lot in the clinic. It really is very effective. Some patients think it's a little bit uncomfortable. Some patients think it's very enjoyable. It helps kind of break them up and makes them feel a little more loose. If you have any more questions or you would really like to experience myofascial decompression therapy, please come visit us at Sport Back and Pain Management Clinic in Bryan, Texas. Thank you.